Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a January 19th, 2022 update from the Dubuque County Public Health Incident Management Team. Dubuque County, the state of Iowa, and pretty much the entire country continue at high transmission for COVID-19, with 1,003 cases reported in the last 7 days. That's another big increase from the 909 total I reported last week on January 12th. Adding to this bad news opening statement, guess what? We haven't peaked yet, and the case curve continues to go up. Omicron continues its surge, estimated at 100% of Dubuque County positive tests and 78% of the cases in Iowa. So January and Omicron march on. Since testing supplies at healthcare providers and retailers are limited, it's more important than ever to stay home when you're sick with anything, whether it's a cold, stomach flu, or influenza symptoms. As healthcare providers have to prioritize testing for symptomatic people and those undergoing procedures, keep in mind that Test Iowa at-home kits continue to be available and reliable. They do, however, require quarantine while you await test results if you're unvaccinated or not up to date on your COVID vaccines. The incident management team keeps the city and county websites updated with testing that's available in the community. Another option is the new federal at-home delivery program. To order your free 4 rapid test kits, go to covidtest.gov. They won't be delivered for at least 7 to 12 days though. I talked about testing extensively last week, but I want to emphasize a couple very important points because of the testing supply shortage. Number 1, do not test yourself for return to work or school or other activities. And 2, do not test yourself to shorten quarantine times. Remember me saying a long time ago, you cannot test yourself out of quarantine? Well, you can't test yourself out of a shorter isolation period either. Simply follow the CDC isolation guidelines for when you're positive for COVID-19. This will also help with the testing supply crunch. As a review, CDC shortened the recommended time for isolation from 10 days for people with COVID-19 to 5 days if they're asymptomatic, followed by 5 days of wearing a mask when around others. Therefore, people who test positive should isolate for 5 days, and if at the end of those 5 days they don't have symptoms, they may leave isolation under 2 conditions. Number 1, if and only if symptoms are substantially improved. In other words, no fever, little coughing, sneezing, or otherwise spewing out virus. And 2, if and only if they can continue to mask for 5 days to minimize the risk of infecting others. As long as you meet those 2 criteria, you can do 5-day isolation. No problem. And that's way easier than the previous 10-day isolation requirement. And one more thing, when you're counting the 10 days for isolation or quarantine, Day 0 is the first date of symptoms or the date you test positive, whichever is first. Day 1 is the following day. Count it or draw it out on a calendar. That's what I've had to do about a gazillion times since this pandemic started. Finally, adding to the changes in guidance, CDC has updated their mask and respirator guidance to prevent the transmission of COVID-19 based on the latest data and research, especially around the Omicron variant. Masking is a critical public health tool to prevent the spread of COVID-19, and it's important to remember that any mask is better than no mask. But to protect yourself and others from COVID-19, CDC continues to recommend that you wear the most protective mask you can that fits well and that you will wear consistently. N95s and KN95s are the most effective at preventing the spread, followed by disposable surgical masks. Cloth masks should only be worn if they have multiple layers of tightly woven, breathable fabric, a nose wire, and fabric that blocks light when held up to a bright light source. In closing, looks like we're in another cold spell. And if you're an outdoor winter sports person, get out there and ski, skate, or snowshoe. Even a walk is great, provided the sidewalks are clear of snow and ice. These are great COVID-compliant activities, as long as you stay out of the lodge or warming house. If you're like me, you may be stuck on the treadmill or exercise bike in your basement. Whatever the case, get some light in some form, and most of all, stay COVID safe by wearing an N95 or KN95 mask, or at least a closely fitted one when you're in public or crowded indoor spaces. See if we can make my peak prediction wrong next week. And think of these words by Tim Ferriss. What you don't do determines what you can do. Stay safe, everyone, and thanks for tuning in.